Before we begin, note that this is only for informational purposes on how to read reports and not a treatment plan. In no way, form, or shape, this will replace a doctor's consultation. India is shaken by the new COVID-19 strain surge, and tests like rapid antigen test or the RT-PCR test have become unreliable. Added to this, the biggest challenge is that the test results aren't coming any sooner and the false negatives are making it worse. The delay in the test results is happening even in the case of CT scan or the blood work. When cases have declined during the later part of 2020 and early 2021, there were resources, test results came sooner, doctors and hospitals were available. Not as many patients needed oxygen support for the first strain. Now, the situation is entirely different and dire in India. The media and internet are heavily inundated by too much information, which may be too complex or confusing at times. This is creating panic among people and unable to garner courage or wisdom to do the right things at the right time. This is why, in this video, we sincerely attempt to give the basic 5 pointers to look and also be able to read the results on the standard test reports. A slight fatigue, a slight headache, a slight cold or fever, anything at this time is a symptom that may have been COVID. Keeping yourself knowledgeable enough is always helpful, and especially during these unprecedented times where there is low to zero availability of hospital beds, oxygen supply, and doctor's time. Below are some very vital points to keep in focus when dealing with COVID-19 infection. Check your saturation levels regularly. 4 times per day is recommended by doctors. Before a meal each time. Before breakfast, before lunch, before snack, before dinner. Do a 6-minute walk test and check your saturation after the walk. If it falls below 5 points, then it's a red flag. For example, if your saturation was 98 before the walk and if it is 92 or 91 after the walk, then it's a red flag. Also, if your saturations drop below 94 at any point, then it is also a red flag. Talk to the doctor, you may need oxygen support. Note, when you are checking saturations, make sure your fingers are dry and also the oximeter is dry to get accurate reading. Also, to make sure the reading is right, you can check more than one finger and it could be either hands. If you observe any trend that the saturations are dropping, lie down on your stomach during the day and the night. Do the respirometer 1 ball or 3 balls exercise every hour for 5 minutes. Rest, rest and rest. Anything below 94 requires a doctor consultation immediately. Blood tests. Get your blood test done as soon as possible within the first 1 or 2 days itself. Don't delay. This is a very important test that will make you understand your inflammatory markers. The typical lists of tests prescribed by doctors is CBP, complete blood panel, CRP, C-reactive protein, renal function test, HbA1c, which is average blood sugars, liver function test, LDH, lactate dehydrogenase, ferritin, D-dimer. Repeat blood investigations, CBP, CRP, LDH, ferritin, D-dimer every 4 days. Let's look at these important numbers a little deeper. D-dimer. D-dimer tests are used to help rule out the presence of an inappropriate blood clot. Some of the conditions that the D-dimer test is used to help rule out include deep vein thrombosis, pulmonary embolism. And what is a normal D-dimer for Ng per ml? The normal D-dimer range is 250 Ng per ml or 0.4 mcg per ml. In this example report, you can see the elevated D-dimer number. CRP, C-reactive protein, is a protein made by the liver. CRP levels in the blood increase when there is a condition causing inflammation somewhere in the body. A CRP test measures the amount of CRP in the blood to detect inflammation due to acute conditions or to monitor the severity of disease in chronic conditions. According to Mayo Clinic, for a standard CRP test, A normal reading is less than 10 mg per liter. A test result showing a CRP level greater than 10 mg per L is a sign of serious infection, trauma, or chronic disease, which likely will require further testing to determine the cause. Some experts say that CRP until 25 is moderate and severe cases can go up to 50 to 100 mg per L. But the doctor will be better able to determine. The CRP in this report is higher than 10 mg per L. Ferritin. Ferritin is a blood protein that contains iron. A ferritin test helps your doctor understand how much iron your body stores. If a ferritin test reveals that your blood ferritin level is lower than normal, it indicates that your body's iron stores are low and you have iron deficiency. As a result, you could be anemic. Normal ferritin levels range from 24 to 336 micrograms per liter for men, 11 to 307 micrograms per liter for women. Ferritin in this report is in the normal range. LDH serum. The lactate dehydrogenase test looks for signs of damage to the body's tissues. LDH is an enzyme found in almost every cell of your body, including your blood, muscles, brain, kidneys, and pancreas. The enzyme turns sugar into energy. The LDH test measures the amount of LDH in your blood or other body fluid. Typical ranges of LDH levels are shown in the table below. The LDH value in the report is higher than the normal range. You know that there is an inflammation based on the numbers you see so far from the example report. Any abnormalities in the test mentioned are indicators that you need a doctor consultation immediately. Chest scan or CT scan. As per the doctors, go for a CT scan only after day 7 or if there is a persistent cough. Otherwise, the results aren't accurate. The CT scan test is called the High Resolution Computed Tomography test. Below, you will see a sample report where you will notice that level of lung involvement written down for a patient and also their observations. Overall, to understand the severity, you will use the following table. Less than 8 score is a mild severity, 9 to 15 is moderate, more than 15 is a severe case. Generally speaking, the milder cases have less complexities unless they have comorbidities like diabetes or blood pressure. This is only a general observation and the infection is pretty individualized based on several other factors. So far, you understood about the basic and most vital tests for determining COVID-19 inflammation. Also, there are few other suggestions. Follow a high protein, high fiber diet and drink 3 to 4 liters of water per day. Sleeping in a prone position is important. Here are the positions below. The virus needs to be fought individually as if you are in a war. There is no room for ignorance, negligence or dependency on others to help or guide you. We are hopeful this information has helped you learn something new so you can tackle the virus. Stay safe.